Thank you so much for joining us today, Dr. Hassan. Today, we're talking about functional neurological disorder. I live with functional neurological disorder, a condition that completely rewrote my life when I was diagnosed back in November 22, when I was sitting in the neurological ward at the hospital after struggling with sight issues. My speech became troublesome by way of being able to push out words, and it felt like I was having a stroke. As someone who's fiercely independent, very strong-willed, professional work-wise, always looking at kind of outcomes and success, to then becoming someone exhausted with tics, with seizure type episodes, so brutal panic attacks that I couldn't go out of my house, and feeling this profound isolation with all of these symptoms, to being discharged from a hospital with no little more than a post-it note, and then left to navigate the kind of multidisciplinary support system that I had been told I needed as part of the symptoms that I have, and spending my first 6 months going to 55 different appointments. I really understood the harsh reality of my new life with FND, and certainly what the broader kind of community with FND goes through. And I've slowly, over the years now, started to learn how to start to deal with things, understand the process of acceptance and recovery. And that's why I'm super excited to have you on with us today, Dr. Hassan, who is a consultant psychiatrist and FND specialist, worked at the FND clinic 15 years, and is about to launch a new book all about FND and three pillars around understanding, validation, and recovery. A warm welcome to you, Doctor.
Thank you, Nada. Thanks for having me and for your time. And I'm so sorry to hear about your experience with FND. And sadly, this is not uncommon. Sadly, many patients have very similar experiences. And one of my missions, you can say, in life is to try and improve awareness of FND and try and help people understand what the condition is and help them find the right sort of treatment pathways that would help them. So
Oh,
thanks for having me and let's chat about FND.
thank you so much. And I am very grateful to hear your dedication, and look, for someone that's dedicated so much of their life to supporting people with FND, and for anyone that's listening that's new to FND, how would you explain what FND actually is to somebody who doesn't know what it is?
So FND is a common condition and it's a condition that sits at the interface between neurology and psychiatry and psychology. So it sits in both the physical and mental health camps. And there's different ways of understanding FND. And because there's no single cause for FND, my approach has always been to try and help people understand their particular situation, develop their own perspective on what's going on for them. And we can think of FND as a condition where the structure of the nervous system is intact, but there's something going on which is creating some malfunction in the system. So for whatever reason, the nervous system is not able to function at the optimal level. And people with FND have different symptoms, and each person may have a different set of symptoms. And that becomes more challenging to kind of treat and group them all under one umbrella. But the starting point is there's some malfunction with the way the nervous system is able to kind of function where structure is normal.
Thank you. And that's definitely the starting point of the journey, is really understanding what it means to have FND and those that are around you. You chose this field of supporting people with FND, which has historically fell really in the too hard basket. And, you hear about hysteria was the historical reference, and there have been several other renaming of the condition and its evolving nature over the decades and centuries. What was the turning point for you at your clinic that you realized that you didn't want to just do the work in the clinic, that you actually wanted to write this book and share your learnings with others?
Well, you're right. Sadly, old terms like hysteria and conversion, they are still very much within our psyches, and that can really affect the way we see FND. What inspired me to write the book was because I wanted to make a difference beyond my clinic. And I was noticing that many patients were not able to access treatment because of structural barriers. And I wanted to also try and get them understanding the condition before they got to the treatment clinic. So that duration between the diagnosis and start of treatment is very crucial. So the earlier people understand what FND is, understand and appreciate their own unique journeys, the better chances are of recovery and healing. So that was the main inspiration.
And that's amazing to hear, because half the journey with some people is the difference in symptoms that they have, and then also other conditions, but then also just the validation that, not faking it, that it is a real condition. The second pillar of the book is about validation. There is an overwhelming sense of an abandonment in the community. I see it all the time on FND Revolution's socials, where in my instance, I got a poster, other people have got leaflets, a scrunch of paper, told just Google it. And then I guess the question is, why does largely mainstream medical community so resistant around FND and supporting people when it's kind of frequently dismissed, and people have to kind of go it on their own?
So it's important to remember that FND is a real condition, and it's a condition that is well studied, well recognized. And I think the main difficulty we are seeing is that the medical model is set up to actually help patients who have something structurally abnormal gently. So where FND comes up with a normal brain scan or a blood test, that's where the struggle begins. And there's no blame here on anyone. I think everyone working in the system wants to help patients, but FND doesn't sit neatly within that kind of spectrum. And that's the challenge where the challenge begins. If you're seeing lots of patients with a brain structural problem, and then someone comes along who hasn't got that, where do you start? So that's been one of my aspects in the book that I focused on, is around for each person, how do you actually understand the condition? How do you broaden the perspective? And how do you find validation and try and get along your journey in a much more efficient way? That's been a focus.
I love that. I love that. I think sometimes, and like I said, some people have multiple conditions in addition to FND, and it gets hard. Like untangling everything that you're trying to navigate through, as well as your own life, is really part of the large challenge. Now, under the pillar of understanding, many patients experience a terrifying kind of clinical loop that once they receive the diagnosis, every subsequent and unrelated health issue gets kind of blamed on it. And the diagnostic searching stops. How do we build a true clinical understanding so that FND doesn't become a catch-all bin for doctors who give up looking for underlying case,
Yeah.
causes, sorry.
Yeah. No, I think that's a very tricky situation because we want people with FND to try and understand what's going on for them. And every time they have a symptom of their condition, The idea is not necessary to go to A&E, for example, because that is not a very helpful outcome. However, you cannot blame every symptom to FND. So I think it's a very tricky balance, but it's about understanding what is the usual symptom cluster that is happening for each patient, and at the same time looking out for a different health condition that might have started as well. So for practitioners, it becomes really important to not to dismiss every new symptom as an FND symptom. I think if there's something which is a new and something looks different, that needs to be looked into and make sure that there's no other condition going on because there can be a lot of overlap, as you know. FND can coexist with lots of other health conditions.
So, one of the areas that patients certainly are challenged with is the financial toll of being able to get the right services they need. So, one of the questions I have is how are sufferers supposed to navigate the system when their physical symptoms force them to give up work, yet the comprehensive care required to get well forces them into a bit of a financial ruin? How does the book that you talk about help with the infrastructure that kind of currently feels quite rigid for the patients to be able to kind of navigate?
Yeah, I think part of the answer is that depending on where the patient lives, their particular health system might be, structured a particular way. And in some countries, there is access to a health system which is free at the point of delivery, but sometimes there is a payment involved, I guess. What I've tried to do in the book is try to empower the patients to try and develop an understanding of their condition and to know that there is a range of treatment available. So it doesn't just have to be psychological treatment. It can also be sometimes physical treatment. So some people need physiotherapy or OT, whereas some might need to see a psychologist or psychiatrist. So if people are able to understand the condition and try and see what they need most, and then use that to then advocate for themselves and talk to their doctors and find the right referral, the right pathway, that becomes much easier with the information.
Yeah, I do. I completely agree with that approach where rather than trying to get it all done at once, which I know I was trying to do, I just need to get better. I don't have time to be sick. How do I get it all done yesterday? I think that adds to the challenges sometimes, not all cases, but certainly sometimes when we're left to our own. And even in my case, I had to educate my psychologist and psychiatrist on FND. I had to educate my GP on what FND was. Um, so it's certainly a lot easier if you start to break that down. Now, when we talk about understanding, many patients experience a terrifying kind of clinical loop. Once they get diagnosed with FND, everything that they start to have thereafter gets put under this umbrella around FND. How do we build a true clinical understanding so that FND doesn't become a kind of catch-all bin for doctors who give up looking for the underlying issues?
Yeah, I think that's a real challenge sometimes because what we want patients to understand that the FND can have a number of different symptoms. So if the same kind of symptoms coming up, then there isn't a lot of point in actually having another brain scan and exposing themselves to, possible radiation. At the same time, a new symptom which looks not like FNDL, a new condition perhaps, that needs to be looked into properly, needs to be looked into with lots of diligence by the medical practitioners. So if there are symptoms which are new, I would always suggest, get that looked at to see if something else going on because we know that FND can coexist with other conditions as well.
I completely agree, and I love your approach, Doctor. I feel that it's certainly that compassion and empathy that you show when you talk about these things is huge. And so Now, if we kind of start to look at the art of the possible, the recovery side of things, let's take a closer look at kind of one of the final areas that we have in your book, which is around the recovery. What does a truly effective holistic recovery pathway look like if a patient is newly diagnosed or facing severe acute symptoms like a sudden and total loss of mobility in their legs for months at a time? Where do they begin? What does the first 30 days look like? You know, in business, we
Yeah.
talk 30, 60, 90 days.
Yeah.
What does that look like?
So recovery is for each patient going to be a different journey because every patient arrives with a different kind of past experience. Their nervous system is different. What they experience in life is different. The triggers are different. So there is no single pathway that we can prescribe for recovery. That's the first point. And when every patient starts the recovery journey, the time taken to find the recovery also is different because we're all so unique. Um, also talk about how recovery is not a straight line in the book. So it's not about every day being able to make some recovery. There might be some ups and downs. And in FND, we know that there are some relapses as well. I've had the fortunate experience of working with lots of patients who some of them have recovered fully, but some carry on having symptoms. And it becomes then a long term dialogue with the nervous system around what is manageable, what are the triggers, how can you live well with FND? Because FND for some people can become a chronic condition. So I think having that sort of realistic outcome framework that it's absolutely fine to be optimistic and hopeful because without the structural problem in the brain nervous system, recovery actually is possible. At the same time, understanding what's actually holding me back, what are the barriers to recovery. So we talk about that as well in the book. So it's a big picture and it's quite unique for each person, the recovery journey.
I love that. And look, I think it's really important that you are real. And I love that you speak about the realities of both the successes and then also people that are challenged ongoing. Unfortunately, that seems to be the Pandora's box of FND, but I genuinely feel that there is that hope of being able to obtain still that livability. If nothing else, that you can bring back that livability element. It might not be like before, it might not be perfect, but at the very least, having that livability capability is huge. And that's why I'm excited here around the retraining of the network, you know, um, the psychology versus the psychology side of things. So FND flare-ups are frequently triggered by intense physical burnout. I certainly still feel the kind of while I'm feeling good, I go for it. While I'm not feeling good, then I take the boom bust kind of
Yeah.
approach is that's my specialty. Um, Post-viral illness or profound neurological stress, yet mainstream medicine often jumps straight at the standard psychotherapy and CBT. How does your framework bridge the gap between emotional triggers and physical neuroplasticity drills?
Yeah. So I think the first point to say is that where the nervous system is functioning suboptimally, anything which is additionally stressful can be a trigger. So you noticed rightly about physical exertion, about having a viral infection, or some kind of a stressful event that happens. All of those can actually trigger a flare up. And it is not correct, I think, to prescribe a standard treatment for everyone with FND just because everyone is so unique. So I think I've tried to understand FND through that wider lens in the book and tried to empower patients to understand what was their life like before FND and what happened and how did the post FND world look like for them. And if through that journey they're able to build a picture which is unique to them, then that I'm hoping would lead to a place where they can then look for particular bits of treatment. And therapy is a broad term, CBT is a broad term. Within that model, what specifically would help? That's an important thing to get to.
That's so true. I went through 2 years of therapy, including CBT as well as exposure therapy. And certainly it got me back to being able to work full time and be able to get to a new way of living. It did not get me back to my pre-FND. But again, it's about trying to focus on the wins. And I often speak to many people in the community about really harnessing those wins. And they don't have to be huge. And they weren't huge for me at the start, by no means. Leaving the house was like on my own, let alone
Yeah.
when I went traveling by myself and didn't have a meltdown, disco dancing at the airport with my seizure style. You got to laugh. But it is about celebrating those. And I
Yeah.
find that often we're our own worst enemy is in not really leveraging that. Now, I mean, that brings us really nicely into navigating relapses and plateau, which I find also is sometimes just being constant. I'm constantly on that fear factor, like just on edge always. If I leave the house or I'm walking downstairs or I'm going somewhere where I know I am going to be by myself and I'm going to be challenged. Um, why do some people achieve total remission only to experience a sudden relapse and lose those gains? How can a patient stop the psychological panic from feeding the physical cycle during flare-ups? And how can long-term patients break through that flatline plateau? There's a few questions there. So
Yeah.
yeah,
So
maybe start with kind of that difference.
yeah. So I think in the book I talked about making sense of the symptom. And I think that sense making is really important. So if we understand the usual triggers, what causes a flare up, then it allows people to actually prepare for that. And it's all about preparation and trying to kind of understand what what you can safely do within that framework and what might be a bit tricky. So by trying to use that kind of approach, we are trying to reduce the risk of relapse. Now, sometimes despite every measure, there might be a relapse. And we've seen that as well. Sometimes there's just no reason, or it's very hard to understand why there's a particular person having a relapse.
So to start off, brain zaps. What is the psychological root cause of brain zaps? Caused purely by FND, and how can they be managed?
I think for each person different. So I would want to understand for a particular patient what they mean by a brain zap, what happens, and what they really notice. Do they notice a buildup of particular stress or a change in their environment? And I think if they understand their unique situation and why a brain zap happens, then that helps them to manage the situation better. So I've tried to not prescribe a particular sort of answer for in the book. It's about people trying to make sense of their symptoms by understanding what's going on for them in their particular life.
Yeah, no, I love that because one of the things that I often hear is when I put up research that I found that people don't feel like they fit in that basket. It
Yeah,
wasn't stress related. I didn't have trauma in my life. I didn't
yeah,
have COVID. I didn't have, like, so you're spot on. It really is about starting to focus on that area.
yeah.
Um, Medication roles. Is there a role for targeted short-term trials of medication? Benzodiazepines is
Benzodiazepines,
one,
yeah.
yeah, is one of the ones that was noted for like functional seizures, for example. But there's also for anti-anxiety medication that's often prescribed despite the lack of major clinical trials. What's your thoughts on medication?
So we don't use benzodiazepines largely because of the risk of dependence, and then we end up having another problem on top. Anti-anxiety medication, if you're talking about antidepressants, there might be a role there if there's comorbid depression, anxiety going on as well. So again, it goes back to each person's unique set of symptoms, what's going on for them. So there is some role for medication, but I would avoid benzodiazepines.
Okay, thank you. System support. How can we push for universal recognition of FND on major support grids and disability pensions so patients aren't left stranded financially?
Yeah, so FND is a condition is recognized within the sort of systems of classification. So it should really be treated on par with any other condition, any other neurological condition like MS or Parkinson's. FND has to have the same sort of weight, and I think it's only right that we raise awareness and everyone in the system sees FND as a real valid condition that needs the same kind of support that everybody else needs.
I couldn't agree more. Now, to close out today, when we talk about the next generation, if you could implant just one foundational truth about FND patients into the minds of every graduating junior doctor this year, what would it be?
I think it'll be treat the patient and not just the symptoms, look beyond the diagnoses and understand the patient's perspective and their own journey, include them in the treatment planning.
I love that. And the horizon, if this book accomplishes everything you envision, what does the clinical landscape look like for FND 5 years from now?
That's a tough one, I think. Well, I want to say that um, I'm hoping that the awareness will improve. I'm hoping that there won't be barriers to treatment, and I'm hoping that both patients and professionals can talk about FND without getting scared, without feeling the kind of pressure that currently there is in some teams.
Oh, I love that. And then the final question. Looking back at your career and the stories that fill the pages of this new book, what is the single greatest lesson about human resilience your FND patients have taught you? One that you personally practice when your own life gets heavy?
I think it would be that setbacks and flare-ups or disappointments are actually common in life. So we go in circles, and life is a big cycle. And whenever there is a setback, it's not to get disheartened, is to understand, what sense we can make of the setback and how can we actually move away from the setback and towards a more positive and fulfilling life. That's the key message, I think, really.
I love that. I am incredibly grateful for your time today, Doctor, and I am so excited about the launch of the book. I certainly want to catch up with you after to hear what the feedback has been like and to hear the impact that it's had on both the professional side of things, but then also patients. Can you just lastly, before we head off, when is it going to be live? Where's it going to be available?
So I'm hoping that it'll be published at the end of August, and it'll be available on Amazon.
Amazing.
Mhm.
Oh, take care. Thank you
Thank you so
so
much,
much,
Nada.
Doctor.
Thank you so much. Take care.
You
Thank
too.
you.
Bye.